So you do, I guess, different levels of sedation dentistry.
Yes.
Who's a candidate for this? Who wants it?
Well, who wants it? Usually it's two people. The dental phobic, number one. Okay, I'm a dentist, so it's easy for me to be in the dental chair, but even my wife, she has to be sedated. Okay, so not a lot of people like to be in the dental chair. And especially when we're doing multiple procedures, it's hard to keep your mouth open. It's hard to go through what we do in dentistry. So if we can sedate the patient, they're comfortable, they don't remember anything, they wake up and the treatment is done. That's number one, okay, the phobic. Number two is the very busy person. This is like the CEO of the company, the lawyer, you know, the super busy soccer mom. And they come in and they say, I've got a day, I've got to do all this stuff. We can put them to sleep, do the work, even with a team atmosphere with some of my partners together, and we can get all the work done in one day. And this really makes it convenient for everybody.
You do it? I mean, this is typical? This is common?
Yeah, we do this all the time, and it's becoming more and more and more because people are finding out about this. Because not a lot of doctors offer this. Not a lot of people have the training.